Hi, and welcome to Chapter 11 on Solution Focused Therapy. As we move into the study of solution focused therapy, I think you're going to notice that it is different from a lot of the other therapies that we've already studied. Although some of it is derived from the MRI group that we studied several chapters back, um, the similarities kind of stop after a few points. First, like the MRI group, solution focused therapists believe that people are only constrained by narrow views of their problems and the idea that they've gotten into rigid patterns of false solutions. And so the goal or the job of the solution focused therapist is to help them see a broader range of choices. When we talk about solution focused therapy, we are focusing on cognitions rather than behavior. So, what the people think about their problem. We focus on the presenting problem and seek to find the simplest solution. And then we focus on exceptions. And the key word there is exceptions, because exceptions to clients' problems are going to end up being the solution for their problem. Solution focused therapy assumes that people are capable of behaving effectively and they're only blocked by their negative mindset. And a lot of times when people ask me about coming to therapy, I tell them that a lot of times I see the job of the therapist is just having an outside person help you kind of look through your options, because a lot of times the problem has just been right there in front of us for so long, and our view is kind of clouded or skewed. And so the therapist can act as an outside person just to say, have you tried this? Have you looked at that? Why did you think that that would work? And so just giving people other options can be a big part of the therapy process. So the idea is that people already have the solutions to their problem and they just need to look at those and try those. Now, when we talk about normal family development and solution focused therapy, we're going to avoid making judgment calls about what is normal. We're going to look at the client as experts in their situation. They've been living it, they know all the players and the variables there. And we're interested in their language. How do they describe themselves? How do they describe the problems? And we only focus on the complaints that are presented. We don't bring up other unpresented problems. We don't necessarily look into the past. As a solution focused therapist, take that title, solution focused, and we're focusing on the complaint and focusing on a solution for that. So, solutions to the problem are unrelated to the development of the problem. Now, if you're more cognitive minded, you may disagree with that, but for solution focused therapy, we aren't looking at how they got there, we're looking at how they can get out of it. And so, talking about the past and tracking the development of the problem is avoided, and we stay problem focused. No, we don't stay problem focused. We help the client um, get away from being problem focused, and we begin steering them towards effective solutions. Because remember, as I said earlier, sometimes the problem is right there in front of us for so long, and we're just focused on the problem that we are unable to recognize effective solutions. So, some of the goals of therapy: first, we hope to resolve the presenting complaint by helping the clients do or think differently. Have you tried this? Have you looked at this? Let's try this. We trust clients to reach their own goals and help the clients identify the problem solving skills that they have lost sight of. Again, remember, when that problem seems all encompassing to that client, it's almost like they're in a fog, and so they can't even see possible solutions, and they've kind of lost their problem solving skills. And we also help clients locate their resources. What can they use to get where they want to be? Some of the conditions for behavior change. We, as therapists, will amplify the exceptions to their problem. There's probably already some effective solutions in their possession or that they have access to, and just helping them move forward and use those. And then we help them construct some solution oriented narratives. The therapist and the client engage in a discussion that shifts the language of the problem. Remember, they're so focused on the problem, so we're going to kind of shift away from that and become more solution focused, and we're going to encourage positive self talk. This positive self talk will lead to positive thinking and positive problem solving. The solution focused therapist tends to be very optimistic and tries to portray this and pass this on to the client. Therapy assessment. When someone comes in for solution focused therapy, there's very little intake information. Again, we're not assessing how the problems have developed, and so we don't really focus on that, and we concentrate on assessing future goals. Therapy should only include people that are concerned about the problem, not bringing in parents or siblings or spouses for the purpose of digging into the problem and how they got there, but people who may be important or key people in helping with the solution. And then it's important for the solution focused therapist to hear the client's constructions of their problems without having a lot of preconceived ideas about them. What are some of the therapeutic techniques? One is problem description. Ask the clients to describe their problem and what they've tried to do to resolve these difficulties. And usually, what you'll hear is a bunch of things that they've tried and why they didn't work. And so, some of the things that they tried may actually be good ideas, and we just need to tweak those and try again. Another technique is the goal setting or the miracle question. And I find the miracle question helpful in a lot of different settings. Basically, you ask the person, if I had a magic wand and I could fix your problem, what would your life look like? Or if you woke up tomorrow and this problem was gone, what would life look like? And what this does is this gets them thinking about what their goals are, where are they trying to get, what are they trying to achieve? Because again, so many times they're so focused on the problem, they can't even think about what life would be like without it. So, this is a great way to get them to set some goals. Another technique would be exploring exceptions or questioning the exceptions. And this would be when you have clients talk about times when they didn't have the problem and then talk about what life was like during that time. You will find that sometimes clients don't know what to do if they don't have a problem. We talk about people who, kind of feed on the drama or they manufacture their own drama. I don't know that they mean to do that. They just really don't know what to do if life was good. And so this kind of lets you look into that. And then scaling questions. Again, you can use this in a lot of different situations, but you would just ask them on a scale of 1 to 10, how sad do you feel? Sometimes I like to do it from week to week. Okay, last week you were a 4. On a scale of 1 to 10, where would you say you were this week? And you can kind of track progress, but it also helps you talk about some of the topics and why they would score themselves a 4 or a 7. Now, when people give you a 5, which they do a lot, I always tell them, okay, you haven't really told me anything by being a 5. But this will just kind of be a conversation starter and get you into the topic of what they're struggling with. Another technique would be coping questions. How have you coped in the past? How have you dealt with this? How have you gotten through having this problem in your life? compliments. These aren't fake. This isn't flattery. But when the client has done something that you feel like is a positive move, then you just bring attention to the fact that they've already done some really good things, or they've already done some really hard things, or they've already done some really insightful things, and just pointing out the strengths that they do have. And then, as I mentioned earlier, later sessions are devoted to measuring progress. So, whatever we're working on, we're kind of seeing how we progress. And I find this helpful too. As I start the session, I'll look back at the past week's notes and kind of retrace where we've been to help them see either the progress that we've made, or, okay, it looks like we're kind of spinning our wheels and stuck. What is going on there? How do we evaluate the theory and the results? Well, solution focused therapy has become very popular, and our authors suggest that maybe it's the treatment for our time. Also, you may hear the term brief therapy or brief solution focused therapy, and a lot of times because of insurance constraints, therapists use this. Some insurances may pay for 6 sessions, which is typically your brief therapy window. And so a lot of therapists may find that solution focused therapy gets them where they need to be in the time frame that the client has. Um, to critics, solution focused therapy seems very simplistic, and you can see from the other therapies that we've studied, if you believe that it's very important to go back to some of the root causes, if you believe people have to work through some gaps in development or different things, then this would seem very simplistic and maybe like a quick, fast fix that maybe wouldn't be a permanent fix.